Hello, and welcome to the Orthodontic Products Podcast. I'm your host, Alison Werner. Today, we're kicking off our 2024 season with Dr. Robert Tito Norris. I had the privilege of profiling Dr. Norris for our September 2020 cover story of the magazine, which at the time coincided with the launch of the Norris 2026 passive self-ligating bracket and wire system he developed with DynaFlex. And now we have him back to talk about the systems, products, and technologies he is employing to achieve clinical excellence so efficiently, and how that translates into a better work-life balance. Dr. Norris, thank you for joining me today.
Thanks for having me, Alison. I really appreciate it.
Great. So for those in our audience who aren't familiar with you, can you talk about how you got into orthodontics and your current practice?
Sure. Well, I guess I got to go all the way back to college. And first of all, I should probably say that I'm in treatment myself right now. I have a MARPE. I've got a nice little gap between my two front teeth. And I'm not enunciating as clearly as I might otherwise do. I've got a big old custom MARPE in the roof of my mouth. Okay, so back to college. I was studying mechanical engineering at UT Austin, and my whole life I really wanted braces. And for the first time, I had a job, I had insurance, and I of course I had a little money. And so I went and I got orthodontic treatment while I was in college, and I was just kind of sitting there in the chair when I had this epiphany. It's like, you know what, orthodontics is just a lot like engineering, just in the mouth, and there's actually a person attached to it. And not only that, that person has feelings and has definite emotions attached to their teeth and their smile and so forth. And I noticed myself as my tooth became straighter, just becoming more confident in myself and in my smile. And to me, it was an amazing transformation. And the fact that I could kind of use my engineering training and the ability to kind of think in 3 dimensions and solve 3-dimensional puzzles to apply it to this profession. So I made kind of an about face, and I left the College of Engineering, went into pre-dent, and was able to kind of quickly get those prereqs taken care of, and then sort of like the rest is history, if you will. I have to say that when I was studying engineering, I mean, I could do it, I could force myself to do it, but I didn't love it. And I'll never forget, like, my first week of dental school when the dental anatomy professor assigned us a book chapter to read, and then I read it, and I just was fascinated with the anatomy of the teeth, and the fact that every tooth has a different function in the mouth and a different shape to form that function. And so I ended up staying all night, up late. I read that whole book that night, and that had never happened to me in my educational career, where I was just like really passionate about something. And from that point on, dentistry just in orthodontics was just no longer a chore. I mean, it was a pursuit of a passion that I still have to this day. And so, all through dental school, all through orthodontic school, I just absolutely love, studying this stuff and kind of pushing myself to learn more and stay on the leading edge of, what's out there. And that's part of what, led me to some of the things I've come up with over the years.
Okay. And so you're practicing in San Antonio these days, correct?
That's correct. Mhm.
Okay. Okay. So what I want to I know you have a very busy practice. You're treating over 900 cases annually. You had mentioned, we had talked earlier and you mentioned that. So I want to talk about how you create efficiencies in your office and the systems you've employed to treat kind of with fewer visits while maintaining those, those impeccable finishes that you want. So what is key to creating that treatment efficiency while maintaining excellent outcomes in your office?
I mean, I hate to boil it down to just one word, but it really is just one word, and that's systems. You've got to have systems from the moment that the patient answers or calls the office. There's a system to how we answer that phone. There's a very systematic new patient examination, because there's a lot of data that we have to collect in a new patient exam. And we look very thoroughly into things. What's the position of their skeletal bones? What's their airway situation? How they're breathing? How they're sleeping? We're looking at them facially. I love David Sarver's macroaesthetic, mini aesthetic, microaesthetic evaluation. So we incorporate that into the new patient exam. We incorporate Bill Robbins' core diagnostic process into the new patient exam. And I do have a partner and an associate. And so, we each have to have that systematic approach to the way that we assess and diagnose patients. Furthermore, we've had to have systems about, how the braces are placed. And so indirect bonding has been kind of a hallmark. Actually, I've been doing it since residency. It
Okay.
really helps, the bracket accuracy, just get those braces on just at the right positions. And that has been really, really helpful in terms of creating, um, just parity and equality in terms of our cases, because we all get to look through the same set of eyes at how those brackets should fit the teeth. Uh, and then, and of course, with the advent of a more accurate bracket wire interface system, and the Norris system, whereby we no longer have all the slop that we had when we were doing an O2 bracket system. We now have a bracket that actually fits the wires that we like to use. And so, part of that systematic treatment of a patient is to treat a patient using 3 or sometimes 4 orthodontic arch wires, right? So that just really reduces, the number of thumbs in the pie there, and really helps us maintain our consistency no matter who's treating the patient. We can start them very efficiently. We know exactly what's going to happen at the next appointment. All those appointments are very systematic, and the data really speaks for itself. And that is, if you look at what's published out there through American Journal of Orthodontics and also JCO, to get a good finish, on the average is somewhere between 20 and 26 appointments, which is a lot. And so we're treating patients in literally half of those number of appointments. Right now, our numbers are 12 appointments for teens and 13 appointments for adults.
Okay.
And so that is that's really key, and to kind of keep your eye on the prize and look at, okay, how it's like a game, right? And you've got to keep score, right? If you want to win the game, you got to be able to keep score. So we actually have a column within our EMR, our software, and we happen to use Dolphin, where we have created a column where you have to fill in, okay, this is appointment number 1, this is appointment number 2. So it's pretty easy for us to go back and count those number of appointments. And we're really focused on that in terms of, how efficiently can we treat every single patient and get a great result, right? And because we have to have go through another set of systems, another set of checklist, if you will, before the patient get the braces off. What's their incisal split and repose? What's their smile arc look like? What are the buccal corridors? How's the occlusion? All these little things that we all have to go through the same checklist, and that is a system within our practice. And even after the braces come off, then we start looking at things such as, gingival margins, and we look at some of the microaesthetic issues there. What's the coloration of the teeth? We need some bleaching. Do some teeth need some buildups? All those things are once again, it's a systematic approach to how we view things. We do have a number of aligner patients in our practice as well. And of course, that is a fairly efficient way to go, but aligners just can't do everything. And so that's why we've got braces. We do a number of interdisciplinary treatments. In particular, we've kind of known for patients who are having airway issues. In fact, that's why I'm in treatment myself, as I've developed sleep apnea. As I've turned 50, I kind of developed sleep apnea. And so now I'm, treating myself. And I'm honestly, it's the last 10 nights I've slept better than I have in years and years. So it's pretty amazing. Yeah.
Okay. So you mentioned those interdisciplinary cases. Can you talk how does the workflow change? Does the workflow change in any way with those cases to maintain your standards?
It does. Okay. So one of the things that is the hallmark of most of our interdisciplinary cases is that a lot of those cases are going to have wear on the teeth. And basically, this is almost half our practice. 50% of our patients are adults. And those patients that have worn teeth, missing teeth, fractured teeth, whatever. The first step is, well, we're going to evaluate their gingival architecture and see if they have APE, altered passive eruption. That's usually the first step, is to get them back to a periodontist and establish proper gingival architecture. And once we have that, then we can go ahead and send them to the dentist and have them build up those teeth, so that now we're dealing with basically virgin-looking teeth. They're provisional buildups on those teeth, so that now we can use use that as a three-dimensional blueprint for communication between us and the restorative dentists. Because eventually those teeth are going to be restored with, some long-term provisional, something in porcelain usually. But if they can do it in composite or some other resin ahead of time before they get the braces on, then it really helps us because now we have an accurate incisal edge from which we can measure our bracket position. And it just helps the treatment go so much more efficiently. Furthermore, when a lot of these patients have like anterior wear and maybe not quite as much posterior wear.
Okay.
And so when you build up the teeth anteriorly, you're left with kind of a little bit of a posterior open bite because we're going to put them in some bite turbos and so forth. So you're able to use extrusive mechanics, which are much faster than intrusive mechanics, because many dentists will say, "Hey, intrude these teeth for me," and they talk about the maxillary anterior teeth, give them some restorative space so that they can then go back and lengthen the teeth at the end of the treatment. And we like to do it on the front end, where we restore the teeth on the front end, and then we can extrude the posterior teeth into occlusion, and that's a much more efficient way to treat these patients. And many of these patients finish in under a year.
Oh, okay.
Selecting the treatments that are most efficient and selecting the appliance that's most efficient for each particular case.
Okay. But then you have those systems in place where you have kind of that checklist to know what to go through so that you can maintain that efficiency as you're going through, even if the case is a little different or a little more complex.
Absolutely. And we've got different checklists for different types of patients.
Mm.
For instance, we've got a lot of what we do is cuspid substitution. So we have a number of patients who are missing maxillary lateral incisors. And in my practice, we simply don't treat implant implants. We always do cuspid substitution on these cases. So we have a very systematic checklist of what needs to happen step by step in order to produce a beautiful smile and to do it in a systematic manner. And there's certain times when we do each of these different steps, and that's everybody in the practice knows it. And we sit down, the assistants know what's going to happen,
Yeah.
and it really helps things run very smoothly.
Can you talk a little bit about what it entailed to set up something like that, a checklist or a system? Can you take an example of one checklist or system you've put in place and what kind of thought process went into it and what kind of data went into creating that?
Sure. So let's just take the example we were just talking about. Let's say a cuspid substitution case, patient who's missing their maxillary lateral incisors. Okay. So from the new patient exam, I mean, obviously we want to, the beginning point of the treatment is where do you want your maxillary incisors to fit in the face? The maxillary incisors are the central focus of the smile. Okay. And in many of these cases, they need to be maybe even a little bit more forward than where they are right now. And so, before we even bond the case, we will go ahead and convert the cuspids to the laterals, and then we'll basically use some coil springs to push those maxillary teeth into the correct position within their smile, both vertically, and then we look, not only where they are, up and down, but also left and right, and make sure we don't have a cant going on. And also AP, we want to have the right smile projection of those teeth. And once we get that set, then the next step is for us to basically lock those teeth into place. And we use something we call a Y bar. All right. And it looks like the letter Y goes in the roof of the mouth, and it leverages off of two palatal tads. And this would be a system where, the assistant knows, I mean, step one, they already know that we're going to be doing those cuspid conversions. Okay. And so they have everything set up for us to do the cuspid conversions. Step two, they know that we're going to be pushing the teeth, so they'll have coil springs already ready. Step three, we know we're going to be putting in the Y bar, so they'll have all the tads ready for us to insert that. The lab knows how to build the appliance, and the assistants actually deliver those appliances. And then, when we're protracting the posterior teeth, the assistant knows, we've got to have buttons on all the 4s, 5s, and 7s because we're going to protract from the facial to the lingual. So all of those little steps, the team knows. The team knows every single step along the way. How do they know? Because we've done the training. Okay, so we have an in-house. One of our lead clinical assistants is our clinical trainer. And so we review these cases, and any new patient or any new employee, basically goes through this training manual and knows these steps step by step by step.
Okay.
So there's really no surprises here, and it just we have such an amazing, talented team of people because we've brought them up that way. We've brought them through the farm league, and now they're playing in the pros, and when you're a pro, you don't miss a step because you've done it so many times, you've practiced it so many times. And so now it's game time, and I mean, you know what needs to be done. Everything's out, everything's ready to roll. So when I sit down, boom, they just hand me this, and this, and I'm out of there. And it's just simply a matter of training. You've got to have those training, and that training has to be systematic.
Mm.
And we have different levels of expertise among the clinical assistants as well. And everybody has a little ladder or a little carrot to get to the next level, because that next level obviously means better compensation for you when you master the clinical acumen that it takes to do some of these more complicated movements.
Yeah. No, a key component of great outcomes and efficiencies is the products and technologies you employ. And as you mentioned, you have developed several orthodontic products over time that do just that. So can you talk about the products and technologies that are key to you getting the facial aesthetics and finishes you want when you're
Yeah.
treating patients in your practice?
Well, I think that's a great question. I mean, obviously the Norris bracket has been, the hallmark of our practice here for the last 7 years. And the whole thing is, it's all about finishing. And for the first time, we actually have a bracket that fits the wires that we like to use. Most people finish it on a 1925 wire, and with a 20 slot bracket, you can get a really nice torque control of these teeth, a great rotational control. So it's just really control and finishing what it's all about. And when I talked about those efficiency in numbers in terms of 12 or 13 appointments, we don't make up that ground in the first 2 or 3 appointments. We make up that ground at the end, in the finishing appointments.
Okay.
Because the teeth move, you put a little bend in the wire, and the tooth goes exactly where you want that to be, because there's no slop in the system. The system is a very tight. It's the difference between like driving like an old farm truck with a bunch of slack in the steering wheel versus driving like a Formula One race car, where boom, it goes exactly where you need to be. So in a way, this has made us better orthodontists, because it's made us better bracket positioners, and we've got to be extremely accurate with our bracket positioning. So first and foremost, it's just that system right there, of a smaller O2O bracket system fitting a 1925 wire. That's the biggest thing in our practice. Okay. Beyond that, I mean, we live the ART spring. It helps to control torque a little more on the anterior teeth. That's great. We love the CS springs for class 3 patients. We love the motion appliance for early kind of class 2 type of stuff. Those are mostly it. Other things, like for instance, we've got a handpiece, multiple handpieces at every chair, with light. We've got great lighting. We've got suction. We've got great air. I mean, it's just easy when you sit down, because everything is right there. You don't have to ever get up and get anything.
Okay.
Ergonomically, we did a whole thing when I built the office in terms of ergonomics, and I wanted every assistant to have everything. So we have a lot of duplicity at each chair. And so, no one ever has to get up to get a plier. You don't have to get up to get a wire. You don't have to get up to get anything, because you've got every unit is self-contained there.
So it's not just about having the products in the moment of, applying the braces or moving a wire. I think it's having everything in place, from the instruments to the chair, to just be able to get going right then and there.
Execute. Okay. Execute right there. Yeah. And there's no delays. So that that's a wonderful thing. I think I recently saw a patient in a friend of mine's office. I'm not going to mention his name, but oh my gosh, the burrs were over there and the handpieces were over there, and it was just like a madhouse trying to get what I needed down into this one room with this one patient. And and I realized that it's an investment to have all those things, to have everything into each of your treatment rooms. I get it, but it's a one-time expense. And once you have those things, they're going to be there for years and years to come, and you're going to save on, just simply time. I mean, that's your most valuable asset. And so, I mean, it's sort of like, what is it? Penny wise, pound foolish, or something like that. And so I'm just more than willing to make those investments to for the ergonomic efficiencies that we get out of it as well.
Yeah. Well, my next question was going to be, how does this efficiency tie into profitability? And you kind of talked about there making that investment up front with your office design, and making sure you have the resources to accommodate all those patients to begin with. But can you talk a little bit more about how these efficiencies within your treatment have helped with profitability?
Well, sure. The thing is, listen, every case should be kind of broken down to how many appointments did it take me to finish that case?
Mm-hmm.
Okay. So if it took you, let's just take an example. Let's say a $5,000 case and it took you 10 appointments. Okay. That's $500 per case, right?
Mm-hmm.
So the same case, $5,000 case, if it took you 20 appointments to treat that case, well, then you made $250 per visit.
Mm-hmm.
All right. So the efficiency and the profitability is pretty obvious. The least number of appointments makes you more profitable.
Mm-hmm.
And yes, we all care about profit and so forth, but I'm just more at this point in my career, I'm more interested about time. Okay.
Mm-hmm.
So I mean, imagine we have roughly 2,000 patients in treatment, right?
Mm-hmm.
And we're able to treat those patients with half the number of appointments that we might have otherwise treated, or they might be treated in another office. So what I mean, what does that mean? I mean, that's thousands of appointments that we've saved. And so what do you want to do with that time? Well,
Mm-hmm.
for me, that's more of a life balance type of question. And I love what I do. I love orthodontics, but I also love a lot of other things. And I mean, I
Yeah.
love travel, I love skiing, I love my family,
Yeah.
and so it's nice to have that sort of ability
Mm-hmm.
to have some time off, to sharpen the saw, to go to meetings, to do other things.
Yeah.
I don't feel like I'm just always at the office, because I'm not.
Okay. Well, that was going to lead into my next question is actually going to be about the fact that, you do lecture frequently, you do conduct in-office courses. So I'm guessing these fewer appointments, which frees up that time, is allowing you to do those things. So can you talk about that work and kind of the topics that excite you that you enjoy lecturing on?
Yeah. Well, there's no way that I would be able to do all the other things that I do. I mean, I'm a competitive swimmer. I lift weights 3 days a week. I go surfing on the weekends. I take 15 weeks off every year,
Okay.
whether it's at meetings or
Yeah.
lecturing or whatever. And there's absolutely no way I could do that stuff if I weren't extremely efficient at the office. I mean, that's the only way that's ever going to happen.
Mm-hmm.
And so when I give the courses, one of the things, I mean, obviously I love to talk about efficiencies. I like to, teach people how to be efficient, not only in like how to place the brackets on the teeth, but these systems and how to use feeder arch wires and all those kinds of things. What excites me most, I mean, honestly, I love interdisciplinary care, and I have for a long time. I think I think it's next level orthodontics. I think it's you have to think quite a bit on some of these cases, and some of these can be the most rewarding cases when you're really changing someone's life if they've got missing teeth, worn teeth, and they live like this, and they feel like they're almost invisible.
Mm-hmm.
And you give them this new big brilliant smile, and they just, I mean, they're in tears, and they feel self-confident rather than self-conscious. I mean, you can really change someone's life. But I think as I look at the future of orthodontics and what's on the horizon, what's happening, I think the biggest area for growth is going to be in the area of airway friendly orthodontics. Okay.
Mm.
And I don't want to beat people over the head with this, but my practice has changed dramatically in the last 10 years.
Yeah.
And we're helping people in ways that we've never been able to help them before.
Mm-hmm.
And patients come in and we go through a whole exam, and they just came to straighten their teeth, and they end up improving their airway, and they're sleeping better, and they're breathing better, and their life is completely changed, whether it's children or whether it's adults.
Yeah.
And now we have those technologies to help everybody basically. I mean, I'm kind of living proof right here with my with my MARPI going on. I'm 57 years old. I'm very hard headed, and I got a skeletal split of my maxilla, and I basically resolved my sleep apnea here in a relatively short period of time.
Yeah.
And that was unheard of when I graduated from residency 30
Mm-hmm.
years ago. And that we would be, not just straightening teeth, but really helping people live better lives, live longer. I mean, statistically speaking, if you can resolve someone's sleep apnea, you've given them 10 years to their life.
Mm-hmm.
I mean, that's phenomenal.
Yeah.
I mean, what's your most precious, valuable asset? It's time.
Mm-hmm.
And time on this planet. You've given them 10 more years of life. So, for those who have not, gotten on the, I don't want to say bandwagon, but who have not, gone educated themselves in terms of the benefits of a MARPI or a custom MARPI, dome procedures, Sharpie procedures, those kinds of things. If we're not looking at airway, you're never going to find it.
Mm-hmm.
And dentists are in a very dentists and orthodontists are in a very unique position to recognize early signs of airway problems.
Right.
Okay, anything from just like snoring to tooth grinding. Okay, open bites, tongue thrusts. All these kinds of things can tie into that airway component.
Mm-hmm.
That's one of my favorite lectures to give, and it tends to be very eye opening for a lot of patients. And they go back and they look at their patients in a totally different way.
Mm-hmm.
And now that we have all these new tools at our disposal, I mean, orthodontics has been through a major overhaul here just fairly recently.
Yeah. I know before working on Orthodontics magazine, I actually did work on a sleep medicine magazine. So I'm actually curious, have you incorporated questions about sleep habits and breathing into your patient evaluations?
Absolutely, and that's a seminal part of it. In fact, the Shervine Sleep Questionnaire it's diagnostic. It's actually, for instance, remember when you were a general dentist, like if someone brought to you like a bite wing X-ray, and it had it looked like a cavity, a carious lesion on there. I mean, you were pretty much committed to, and you couldn't ignore it, right? Like you would have to treat that cavity, or at least inform the patient that you have a cavity, it needs to be treated, or it could turn into a root canal, or you could lose a tooth.
Mm-hmm.
Well, the Shervine Sleep Questionnaire, which is part of what we do, for kiddos, and we have another one for adults. It is a validated instrument. In other words, if someone answers, 8 or more on that Shervine Sleep Questionnaire, you can send that to an ENT, and they can't ignore it
Yeah.
because for years and years and years, I was trying to do more airway stuff, and sending these patients to these local ENTs, and they would say, well, yeah, they have class 3 tonsils, but I've seen bigger, or insurance isn't going to cover it unless they've had so many infections. Meanwhile, the poor child is not sleeping, not thriving. They're struggling. They're mouth breathing. It's really been a shame that we haven't had the support. But we want you to kind of educate your colleagues and align them and show them what you can do and how they can help as well. It's
Mm-hmm.
really, really great to have that interdisciplinary team
Yeah.
on board with everything.
Yeah. Going back to your lecturing and everything and your in-office courses, do you have anything coming up in the next few months?
Absolutely. Well, there's 2 courses coming up. One is next month, and that's going to be in Scottsdale, and I'm lecturing with Chad Foster there, and that's going to be focused really more on orthodontic aesthetics and finishing.
Mm-hmm.
And that's a course that we've given several times, and the feedback that we've gotten has been really, really positive. Very eye opening for a lot of people. He's got some really, really great stuff to share, and of course we both make some contributions there. And then we do an in-house course twice a year, every May and every October. And those can be found on the DynaFlex website. If you just open up dynaflex.com, it'll pop up right there.
Perfect.
So,
Well,
and
Dr.
once again, the 2-day in-office course, and we cover everything from indirect bonding, MARPI, even systems within the practice, how to answer the phone. We do.
Oh, okay.
I mean, we go through the team actually is very much involved in, taking excellent records, Disney level service, team building, training, all this is a pretty comprehensive thing. And then we go through airway, we go through interdisciplinary care, customer substitutions, auto transplantations. It's more of a hands-on type of thing. So.
Okay. Well, excellent. Well, Dr. Norris, thank you so much for speaking to me today. I really enjoyed our conversation, and I hope our audience finds everything you had to say really helpful, because I think it was.
Thank you so much, Alison. It's been a pleasure.
Right.
Great to see you.
Great. Yes, great to see you again too. Okay, take care.
Take care.
As always, thank you for joining us. Be sure to subscribe to the Orthodontic Products Podcast to keep up with the latest episodes, and be sure to check out orthodonticproductsonline.com to keep up with the latest industry news. Until next time, take care.